Good morning, students. Today we are going to study about the patella. Now, patella, it is the largest sesamoid bone in the body. It is developed in the tendon of the quadriceps femoris muscle, and it is situated in front of the lower end of the femur. Now, as you can see over here, the patella, it is triangular in shape. This portion, this narrow portion which is pointing down, it is called as the apex of the patella, whereas this portion is the base of the patella. It has got two surfaces. This surface which you see is the rough surface is the anterior surface, whereas on the posterior side you can see that the surface is smooth and it is articular. This is the posterior part of the apex. The posterior surface of the apex, it is non-articular, whereas the upper 3/4 of the posterior surface you can see it is smooth and it is articular. Now, on the posterior side, you can see that there is a prominent ridge. You can feel the prominent ridge on the patella, which is dividing this posterior surface into a large lateral area and a small medial area. So, how do you determine the site of the patella? Hold the patella in such a way that the apex is directed down, the base is facing up. Okay, this rough surface is the anterior surface. You can then place the patella on the table. You can see that after placing the patella on the table, it is resting on the larger surface, that is the lateral surface. So this indicates the size of the patella. So this is the patella of the left side. Now, the apex, I told you, the apex is directed down and it gives attachment to the ligamentum patelli. This ligamentum patelli, it connects the patella to the tubercle of the tibia. This is the base. The base, or it is also called as the upper border. From before backward, it gives attachment to insertion of the rectus femoris. This is the insertion of the rectus femoris. Then insertion of the vastus medialis, insertion of vastus lateralis, and insertion of the vastus intermedius. Insertion of the vastus medialis and vastus lateralis, they lie in the same plane, and most posteriorly over here is the insertion of the vastus intermedius. Now, this border you can see is the medial border. This is the medial border. Here you can see the insertion of the vastus medialis. So insertion of the vastus medialis is the upper 1/3 part of the base and also extending on the medial border. This is the lateral border. Lateral border, it receives the insertion of the vastus lateralis. So the insertion of the vastus lateralis is on the base in the upper part and on the lateral border. Now you can see over here that the insertion of the vastus medialis, it extends lower down as compared to insertion of the vastus lateralis. Now, why this is so? It is because during the extension of the knee joint, the patella has a tendency to move upward and go to a lateral side, that is tendency of a lateral inclination on the femur. So, to check this natural tendency of the displacement of the patella to the lateral side, This vastus medialis, which is inserted on the medial border, has a tendency to give a traction on the medial side. So this is how the natural tendency of the lateral displacement of the patella is curtailed. Now you can see this is the anterior surface. The anterior surface is subcutaneous, and a subcutaneous prepatellar bursa, it separates the anterior surface from the skin. You can see the number of ridges on that dry bone, and these ridges, they represent the ossified fibers of the tendon of quadriceps femoris. Now let's see the posterior surface. The posterior surface, the posterior part of the apex, it is non-articular, whereas upper 3/4 part of the posterior surface is articular and smooth. As we have already discussed, it is divided into a larger lateral part and a smaller medial part by this vertical prominent ridge. Again, if you see the medial part, this is the medial part. The medial part, it is divided by another vertical ridge into a broader part, larger part, and a smaller part which lies most medially. This is the medial most strip, narrow strip. This medial most narrow strip, it comes in contact with the undersurface of the medial condyle of the femur along the intercondylar fossa in full flexion of the knee joint. So this is the part which comes in contact with the femur during the full flexion of the knee joint along the intercondylar fossa, along the medial margin of the intercondylar fossa. Now, rest of this articular surface, it is further divided by two horizontal lines. The lines are not very prominent in the patella, so I have marked these lines with the blue pen. You can see the marked lines with the blue pen. So these two horizontal lines, they divide the area into upper two, middle two, and the lower two areas. The lower area, in this lower area, it comes in contact with the surface of the femur in ordinary extension. This lower two areas, they come in contact with the surface of the femur in ordinary extension. Whereas the middle area, it comes in contact during the semi-flexion. And the upper areas, they come in contact during the ordinary flexion of the knee joint. So the uppermost area, it comes in contact during the ordinary flexion, the middle area during the position of semi-flexion, and the lowermost areas, they come in contact with the surface in ordinary extension. In a relaxed state of the knee with full extension, the patella does not make a contact with the femur. It just floats in the joint and does not make any contact in full extension. Now as patella, it is the largest sesamoid bone. It has got secondary centers of ossification. The secondary center of ossification of the patella, it appears during 3 to 6 years of the age, and the fusion is completed by puberty. Now sometimes at the superolateral angles of the patella, these secondary centers may form separate pieces of the bone. So the patella may appear like it is having two pieces, a larger piece and one smaller piece which has developed from the secondary center, and it fails to fuse with the rest of the part. So this is called as bipartite patella, or if the patella is in three pieces, it is called as tripartite patella. But this condition, it is bilateral and it is symmetrical. Thank you.